This is the QTV Nightly News and I am Jul Denjai. Thank you for joining us. Here are the main news headlines. Members of the National Assembly have raised concerns about the growing issue of transhumans activities in the Gambia and have urged the Minister of Environment, Climate Change and Natural Resources, Rohi John Manyang, to provide details on her ministry's efforts to address the problem. In a bid to enhance agricultural productivity and promote sustainable development, over $99 million has been awarded to 39 farmer organizations through the 4P matching grant under the Roots project. Now, the National Health Insurance Authority hosted a signing ceremony on Friday to formalize a memorandum of understanding with healthcare facilities, marking the rollout of the National Health Insurance Scheme coverage across the country. In observance of World Glaucoma Week, the National Eye Health Program of the Ministry of Health, with partners, organized an event at the Sheikh Zayed Regional Eye Care Center in Kanifing to raise awareness about glaucoma. In sports news, ahead of the Gambia's World Cup qualifiers against Kenya and Ivory Coast, national team coach Jonathan McKinstry announced his 24-man squad on Thursday, including 3 new players. These and other stories coming ahead. Do stay with us. Thank you very much for staying with us. If you're just tuning in, this is QTV News, and now let us look at the news stories. National Assembly members have expressed serious concerns about the escalating issue of transhumans activities in the Gambia. They urge Minister of Environment, Climate Change and Natural Resources, Rohi John Manyang, to provide details on her ministry's efforts to tackle this urgent issue. Our Bob has the details.
Transhumance, the seasonal movement of livestock in search of pasture and water, has been a long-standing tradition for herding communities. This practice occurs both within districts and across regions, often extending across borders, especially from Senegal, while essential for the survival of livestock and the livelihoods of herders. Transhumance has also raised significant environmental and security concerns. Suleiman K. Saho, the National Assembly member for Central Badibu, pressed the minister on the government's specific actions to mitigate the adverse effects of these seasonal livestock movements.
Although transhumance activity is more under the responsibility of the Ministry of Agriculture, the Department of Forestry is aware of the challenges it poses on our forest land and resources. The Gambia and Senegal have historically negotiated protocols allowing this seasonal movement of cattle across borders. These arrangements are important to ensure that herders have official recognition, reducing potential frictions with border controls and local communities to mitigate its challenges to our forest land and resources. Action points discussed during the Senegalo-Gambia Permanent Secretariat meeting includes matters related to the regulation of the management of the transhumance activities. My ministry will engage with the Ministry of Agriculture to implement this action point with our concerned sister ministries in Senegal.
The ECOWAS Protocol on Transhumance 1998 acknowledges the transhumance pastoralism as a crucial economic activity and aims to regulate the cross-border movement of livestock within the region. The protocol supports the free movement of livestock while also focusing on mitigating conflicts and ensuring the sustainable management of resources. Following the minister's response, Suleiman K. Saho, now for Central Badibu, shared his thoughts on the government's proposed measures to address the issue.
Honorable Speaker, I'm putting to you that those protocols and those steps taken by the ministers are not followed. These people are in Central Badibu right now, Sabah Sanjali, Kauru, they are all over, and they don't go through the right border post to be quarantined. In fact, they are bringing diseases to our animals here.
My ministry is concerned because it affects our forests as well. Last year I was on a tour. I had a special engagement with some governors on this issue. and even my forest officers, to the extent one group that was arrested and then asked to face the law. What we are doing, or what we should do, is to make sure that we enhance enforcement. And we have regional officers, we have regional stakeholders, we have regional authorities, who should also be doing that, including all of us in every part. So it's a matter of us enforcing the law. We have the laws. It should be enforced by whoever is responsible. So enforcing the law is definitely a critical milestone that my ministry is definitely putting efforts to make sure that all those assigned to discharge their responsibilities do it to the latter. Thank you.
Amid growing concerns over the issue, Parliament approved a motion filed by Suleiman K. Saho calling for a special investigation into the matter by the Select Committee on Environment and Agriculture. For QTV News, I am Awa Bob.
Now, in a bid to enhance agricultural productivity and promote sustainable development, over $99 million has been awarded to 39 farmer organizations through the 4P matching grant. This initiative aims to support post-harvest value addition in the agriculture sector, empowering local farmers and fostering economic growth. Here is Pa Daniel Gomez.
The grant is intended to strengthen smallholder farmers' resilience, promote food security, and foster sustainable agricultural development through strategic partnerships and investments. The 4P in the grant refers to a public-private partnership model where both public and private sector resources are combined to maximize impact. Mamour Aliou Jagne, Project Director of Roots, delivered the opening remarks.
This is very significant because it can play a catalytic role or have a catalytic effect on production, be it rice, be it vegetables, because it has been said, it has been argued that one major limiting factor in terms of production in this country is market access.
Here is Babukar Ojuv, the Minister of Trade, Industry, Regional Integration and Employment.
Commercialize what these farmers are doing. We cannot continue to be in subsistence. And this is one of the reasons, Doctor, I would say, that GAIPA has been directed. I'm glad they were part of this process. They have been directed since 2024 to put at the top of their priorities when they engage investors into this country. And again, it was great that DPS Danso, who is responsible for investment at the ministry, was the participant on behalf of the ministry in this process.
Dr. Demba Sabali, Minister of Agriculture, Livestock and Food Security, highlighted the positive impact this initiative has had in the past and reaffirmed the Gambian government's commitment to strengthening agriculture in the country.
In the CRR, for example, a youth matching grant beneficiary is building a house for his family from the proceeds of his tricycle enterprise. In addition to rendering free service to his community for the sick, especially pregnant women traveling to the health centers. Provided matching grant award to 39 successful applicants, amounting to $99,617,000. This translates to an average of $2.55 million per awardee. And out of this total, beneficiaries will contribute 20%, while 80% will be provided by the government and the Roots project. This counterpart contribution from the beneficiaries is of course designed to enhance ownership and promote sustainability, and is a requirement for the award to be effective.
Both Fatou Jammeh Toure, Deputy Permanent Secretary for Projects and Programs at the Ministry of Agriculture, Livestock and Food Security, and Suleiman Boj, Finance and Operations Manager at Radville Farms and board member of GCCI, expressed their gratitude for the effective collaboration among stakeholders and their ongoing commitment to the project. Marti Da Silla, one of the awardees, expressed her appreciation on behalf of the farmer organizations.
We are deeply grateful for this generous gesture. We assure you that the funds will be used wisely, and by the grace of God, the purpose of this award will be successfully achieved.
As part of the $99,617,000 award, these farmer organizations will receive 22 trucks, including 5 refrigerated trucks, 7 warehouses for storing grain, 3 cold stores, and 6 drying floors. Reporting for QTV News, I am Pa Daniel Gomez.
Now, the National Health Insurance Authority, NHIA, hosted a signing ceremony on Friday to formalize a memorandum of understanding with healthcare facilities, marking the rollout of the National Health Insurance Scheme's coverage across the country. The agreement will increase the number of healthcare facilities covered by NHIS from 13 to 67 nationwide. Here is Yafatu Gay.
This initiative is part of the government's broader efforts to provide accessible and affordable health care to all citizens, with a particular focus on enhancing maternal health services. Through the scheme, women enrolled in the NHIS receive free delivery services, including both normal and cesarean section deliveries. This reduces the financial burden on expectant mothers and helps ensure safer childbirth. By expanding coverage to more health facilities, the NHIA aims to ensure that a greater number of Gambians, particularly those in rural and underserved areas, can access quality health care services without financial barriers. Baima Sen, the CEO of NHIA, provided an overview of the NHIS expansion, emphasizing the positive impact the increase in health care facilities will have.
This expansion is not just about increasing numbers. It is about reinforcing our commitment to the accessible, affordable, and quality healthcare for every Gambian. A strong healthcare system is the foundation of a thriving nation, and this milestone brings us closer to our vision of universal health coverage for all.
Melvin Judge, chairman of the NHIA board, outlined the details of the MOU and emphasized the significance of the expansion.
This MOU is very important, and there are about 3 partners to this MOU, each of them having their own roles and responsibilities. First of all, as the facilities, okay? That's, the majority of you are here. And for the facilities, your role is to deliver service, to deliver quality services, okay? And to do these quality services, you have some guidelines. What are the guidelines? You have what you call the standard treatment guidelines, not so, because that tells you what to do for each disease or health problem, for that matter.
Moduti Nyasi, who represented the Minister of Health, stressed the government's dedication to improving healthcare access and affordability across the country.
Today, we stand at a pivotal moment of our history where the vision of equitable health care for all become a tangible reality. This initiative is not just a policy, it is a commitment to the well-being of our citizens, to ensuring that every individual, regardless of socio-economic status, has access to quality health services.
The NHIS continues to play a crucial role in transforming healthcare in the Gambia, and this expansion highlights the government's commitment to the health and well-being of its population, particularly women and children. Reporting for QTV News, this is Yafatu Gay.
That report there by Yafatu Gay will take us to a commercial break. When we return, we have more local, international, as well as sports news stories for you. Do stay with us.
mooy fan fii mooy Inessa di place bi nga xam ne moom la ñëpp taam place bi bépp xeetu ataaya bu baax rek bu dugg see ci dëkk bi xamal ne fii rek la am bara wërga bii neex na lool saf na ba pare tamit nag am gu bu neex boo ko naanee rek da ngay kontaan ci saas añ ba suur ba gëreesal li nga lekk jëndal baara ataaya bii ndax moom la ñëpp taam gis nga sama client bii ataaya bu neex bu ne moom laa koy njëkk a jox ndax moom kat ataaya bu neex rek lay wër baara warga bii mooy warga bi gën te moo gën a saf kon nag ràññee leen ko bu baax kon daw leen gaaw ca Banjul foofu ca Inessa di place bi nga xam ni foofu rek nga ko mën a amee wholesale wala retail mu ngi foofu ci boori court house bi foofu ca Banjul wala nga daw ci bépp marché bépp supermarket bépp boutique fépp foo dugg rek di nga mën a am baara warga bii nga xam ne moom la ñëpp di wër tey baara warga moo dàq ci warga yi man maa ngi ci moom ndax su ma mënee ataaya moom rek lay naan.
The future is now. With QCell's 5G network, experience speeds like never before with our new 5G Rocket Fixed Internet plan. Get speeds from 10 Mbps to 100 Mbps. Your 5G-enabled device. Walk into QCell headquarters to get one of our 5G routers and experience the true feeling of 5G. Only with QCell. QCell brings you the future. Tech, innovation, incredible speed. The future is now. For more information, call our customer care on 111. QCell, Sunyabus. We innovate, others follow. Terms and conditions apply.
Welcome back. If you're just tuning in, this is QTV News, and now to the rest of our stories. Now, in observance of World Glaucoma Week, the National Eye Health Program of the Ministry of Health, with partners, organized an event at the Sheikh Zayed Regional Eye Care Center in Kanifing to raise awareness about glaucoma, a leading cause of permanent blindness globally. Here is Yafatu Gay again.
Glaucoma refers to a group of eye diseases that cause damage to the optic nerve, which plays a crucial role in vision. The damage is often caused by increased intraocular pressure inside the eye, leading to vision loss and, if left untreated, permanent blindness. In the Gambia, glaucoma is a major public health issue, with studies showing significant prevalence of the condition. The 2019 National Eye Health Survey in the Gambia reported a weighted prevalence of blindness among adults aged 35 years and older at 1.2%. At the event, experts stressed the importance of early detection and prevention, noting that glaucoma often develops without noticeable symptoms, making it challenging for individuals to recognize the condition until significant damage has already occurred. Dr. Winston Cisse, CEO of Sheikh Zayed Regional Eye Care Center, elaborates.
The prevalence of glaucoma varies among different nations and regions. It appears to be highest among persons of African descent, ranging from 6.5 to 7.3%. Africa is one of the continents with substantial burden of glaucoma, and the prevalence in Africa is twice that of the global prevalence.
In 2020, the number of people estimated to have glaucoma globally was 76 million, and this is expected to increase to 95.5 million in 2030. Bakari Diba, Deputy Program Manager for the National Eye Health Program in Kanifing, gave a background of the National Eye Health Program and its objectives.
So the overall objective of the NFHE was to contribute towards improving the quality of life of Gambians population by reducing the burden of blindness through a comprehensive and quality eye care services, which is accessible and affordable to all Gambians. So the strategic approach of the program is based on two pillars. One is service delivery. We want to make sure that services are available and they are delivered. So cataract, trachoma, glaucoma, childhood blindness, emergency eye diseases due to non-communicable diseases, and refractive errors were identified. And at secondary level, these are the areas, priority areas that we are concentrating on.
The event also highlighted the importance of preventive measures, emphasizing the need for regular eye checkups, particularly for individuals in higher risk groups. It also called for greater public awareness about glaucoma. The NEHP and its partners are dedicated to reducing preventable blindness in the country by encouraging timely interventions and promoting healthier lifestyle choices. Reporting for QTV News, this is Yafatu Gay.
Now, coming up next is international news. Now, scientists at Imperial College London are working on genetic modification that could make malaria-transmitting mosquitoes resistant to parasite. Aliou Cisse tells us more.
Malaria remains one of the deadliest diseases globally, claiming nearly 600,000 lives in 2023, the vast majority occurring in Africa. Despite vaccines and other control measures, the fight against malaria continues. In an infectious disease laboratory in London, researchers are working in an insectarium filled with cages of mosquitoes, specifically the female Anopheles species that transmits Plasmodium falciparum, the parasite responsible for malaria. This research is part of Transmission Zero, an international initiative focused on eliminating malaria through genetic intervention. Dr. Nikolai Winbisila, a geneticist at Imperial College London, explained that the goal is for genetic modification to spread throughout the mosquito population so that every malaria-transmitting mosquito in Africa will eventually carry this. However, before this technology can be implemented in the field, extensive testing and validation are required. Professor George K. Christophitz, who leads the laboratory at Imperial College London, emphasized the importance of proving effectiveness in the lab, that it works and that it works the way they want it to work and accepted by communities and regulators before they can test it in the field. The World Health Organization has endorsed 2 malaria vaccines that have been proven safe and effective in preventing disease in children. However, malaria remains a persistent public health challenge requiring multiple approaches to curb its transmission. If successful, the genetic modification developed by the Transmission Zero team could provide a long-term solution by ensuring that future generations of mosquitoes are incapable of transmitting malaria. The Gambia has made significant strides in reducing malaria incidents, with a 70% decline in cases over the past decade, according to the U.S. President's Malaria Initiative. Despite the progress, challenges remain. The Gambia's National Malaria Strategic Plan 2021-2025 aims to shift from controlling malaria to its elimination, with a focus on comprehensive program coverage in high transmission areas. Reporting for QTV News, I am Aliou Cisse.
Now, up next is sports news. Ahead of the Gambia's World Cup qualifiers against Kenya and Ivory Coast, national team coach Jonathan McKinstry announced his 24-man squad on Thursday, including 3 new players. Our sports reporter Mumudu Gajaga was there, and this is his report.
3 new players, Musa Dibaga, a goalkeeper, Sekou Touré, a midfielder, and Jibril Silla, an attacker, have been included in the 24-man squad for the Gambia's upcoming World Cup qualifiers against Kenya's Harambee Stars and Ivory Coast Elephants. Head coach Jonathan McKinstry believes these new additions have earned their place in the team.
And for the 3 you look at in particular, Musa Dibaga in goals, obviously grew up in Spain, Spanish-born to Gambian parents, signed his first professional contract in the summer with Inverness Caledonian Thistle in Scotland, and has been their #1 goalkeeper all year. So he's maybe put in 23, 24 consecutive appearances, has got man of the match in a number of appearances. Sekou Touré, obviously someone I think a lot of Gambians will know about, has had some injury problems in his early part of his career, but this season he's really had consistent form. You know, ever since he's got into the team around September time, he has been a regular. He started about 90% of the games for Grenoble in central midfield.
Despite missing out on a qualification spot for the AFCON 2025, the Gambia ended their last group away fixture in Tunisia with a 1-0 victory. 2 young players, Abubakar Bari and Mahmoudou Bajo, delivered impressive performances. Coach McKinstry acknowledged their contribution, but cautioned that they must maintain consistency to secure a regular spot in the team.
Bajo's someone who's been around the national team camp for basically since I first arrived. And again, really talented, and he stepped into the team and did well. But I also want to caution this, is that let's not take one performance against Tunisia and say that is what a player will always be. The nature of football, and especially the nature of young players, is they will have games that are a 5 out of 10, a 6 out of 10 performance. And we can't jump on them and be so critical of them when that happens, because it happens to every young player. David Beckham, Ronaldinho, you know, whoever you want to name, they had good games, they had less good games.
Kenya and Ivory Coast are ranked higher than the Gambia in international football. Harambee Stars are under new coach Benny McCarthy, who will be eager for a tough contest against the Scorpions. When asked about concerns over his players' work rate to achieve good results, Coach Jonathan McKinstry remains optimistic and confident.
I would agree I don't want it to happen any time in 90 minutes. And look, the nature of it is you're absolutely right. You know, when we want players to be all action all the time and, you know, responsible for themselves and, you know, take ownership of their performance. And I think 99% of the time, the guys we have 100% do that. Is there moments where people are maybe fatigued or maybe people become frustrated because the game's not going the way they want it to go and for a split second, they're not switched on to do the thing they need to do? Yeah, it happens.
The Gambia is currently second from bottom in Group F with 3 points from 4 matches, while Kenya sits third with 5 points. Ivory Coast lead the group with 10 points, having secured 3 wins and a draw, which came against Kenya. Mamudu Gajaga, QTV News.
The report there by Mamudu Gajaga brings us to the end of this news bulletin, but before we go, here is a recap of the headlines. Members of the National Assembly have raised concerns about the growing issue of transhumance activity in the Gambia and have urged the Minister of Environment, Climate Change and Natural Resources, Rohi John Manyang, to provide details on her ministry's efforts to address the problem. Now, in a bid to enhance agricultural productivity and promote sustainable development, over $99 million has been awarded to 39 farmer organizations through the 4P matching grant under the Roots project. The National Health Insurance Authority has a signing ceremony on Friday to formalize a memorandum of understanding with healthcare facilities, marking the rollout of the National Health Insurance Scheme coverage across the country. Now, in observance of World Glaucoma Week, the National Eye Health Program of the Ministry of Health, with partners, organized an event at the Sheikh Zayed Regional Eye Care Center in Kanifing to raise awareness about glaucoma. In sports news, ahead of the Gambia's World Cup qualifiers against Kenya and Ivory Coast, national team coach Jonathan McKinstry announced his 24-man squad on Thursday, including 3 new players. This is all we have for you in this edition of the Bulletin. Do join us tomorrow at 8 p.m. for another news bulletin. Thank you for watching.